Dear Caroline, very happy to have you here on the PCM4U channel. So Caroline Coy, you're advocate of the patient platform for sarcoma and also ambassador for the Chordoma Foundation.
As you said, I'm Caroline Coy. I've been involved with the US-based Chordoma Foundation since 2016. And I'm one of the co-founders of the Dutch patient platform Sarcoma. Sarcomas are rare cancers of soft tissue and bone. And chordomas, it's good to know, are one of the ultra-rare subtypes with an incidence of 1 in a million. So these diseases have very specific problems. As a patient advocate, my interest lies with the organization of care, more specifically organization of expertise, because I think that's very important for the rare diseases. And that's both on a national level as an international level. I think that the organization of expertise is overseen too much. So I think for a patient, it's very important to get to a hospital where they have the expertise to offer the best care possible. That can be in your own country, but it might also be in another country within Europe. For the chordomas, it can even be in the US. If there are trials there that are not available in Europe, people decide to travel to the US. But the fact that people need to seek for and find centers of expertise, that's so important. And it can make such a difference for the outcome of the treatment and the treatment plans and everything. I mean, it's you get the information you need. You talk to doctors that have seen more of your illnesses and do research and are really investing their time and efforts into that. And that makes a lot of difference, not only for the outcomes of the treatment, as I said, but also for the state of mind, that you feel safe and that you feel understood. And I think that's very, very important. That's really difficult, and it depends on in which country you are. We are very lucky that we are part of the sarcoma community, because that's a very international community, both from patient side as from the expert sides. But even then, it's difficult sometimes to get where you need to be. In the Netherlands, we have two good things, and within the sarcoma community, we have a good starting point. That the sarcoma community is very close together. They work together. It's well established. And also in the Netherlands, we have a procedure where the expertise centers are appointed by the Ministry of Health. That's a yearly procedure, and it's very important for patients with a rare disease. There are still things to become better. We're very critical towards the procedure, but we are one of the very few European countries that have this procedure in place. So I think that's a very good starting point for patients. If you have a rare disease, a rare cancer in our case, and you go to a hospital that either doesn't recognize the disease or think it's a very interesting disease to treat and doesn't follow any guidelines or doesn't seek any contact with the expertise centers, as a patient, you really need to be very vocal and very eager to find the best possible treatment options. And I really think that's not something a patient should do. That's something the doctor should help with. The patient might decide what treatment he wants, and there might be other things important for the patient. The two organizations I'm working for as a volunteer both have a very specific dynamic. So the Chordoma Foundation, because of its rarity, it's really an ultra-rare sarcoma, there are really limited options for patients to join a clinical trial. So I have patients who have traveled to the US for clinical trials multiple times, And if you see what it costs them, not only financially, but also staying in another country without any backup or support of their families for a longer period of time, it's really, really hard. And the disease itself is really, really hard. So it's a very complicated situation and I think not many patients will take the step to go that far and go, in this case, to the US, but maybe also to another European country where the rules and the reimbursements of costs might be better, but still it's so much work to get things arranged, and the burden of it's huge for patients. And I think that's we all see what's happening in Europe, all the good intentions that they are, the registries, Eurocan. There's so much good going on, but the question is, what does it bring the individual patient who is ill at this specific moment? And then I think the burden of going abroad for any treatment or a trial is still too tough. It's too much.
Yeah, clearly. So in the different interviews we had, indeed, we listed several difficulties facing patient traveling for care, so such as cultural sensitivity, the language, of course, can be a limit, the traveling, just in terms of time and costs, and all the procedure and legislation for example, for the care to be paid by insurance, that could be also very difficult. Many administrative procedure.
We always try to find out if somebody's in such situation and encounters a specific problem. We always try to find possibilities. So last year there was a girl from the Ukraine who needed to be operated, and the Chordoma Foundation organized a treatment option in the Netherlands through Eurodisc. So they supported the girl and made sure that she got possibilities to survive. It was as simple as that. So there are no really rules and regulations within our organization, but we always try our best to help people. And sometimes that's a no, because we cannot find anyone who would be willing or interested to support an individual patient. And in general, I think it shouldn't apply to individual patients. It should be more open for all patients. And not only, what we see now is that only the smart ones, that's a really wrong word, I understand, but some people are sick and have no other possibility than being sick, ill, or... So sorry, but I only have a bad example. It's not very helpful, maybe, but we have quite a good expertise center in the Netherlands for Chordoma. That's the Leiden University Hospital. And we have had several people from Belgium seeking treatment there. For some people, it's very easy to get their costs reimbursed, and others have a pending huge debt for treatment in the Netherlands. And then you think, how is that possible? Because there are European rules, and people have the right to seek treatment abroad, especially for such an extremely rare tumor. And if you come home after very, very difficult surgery and you get a call from your insurance, well, you might need to pay 30,000 euros within the European Union. That's impossible. That cannot be. It shouldn't be there. We found it really hard to find support for such cases. But again, I mean, legislation is there and it should be put into use where it's needed. And that's with the individual patients and not on paper or, I think that's the translation to the people who really need it. We're far from that.
Okay. Indeed,
sorry, I have no
striking. Yeah, that's striking, but I think it motivates us and the community to work toward that. And so financial, in fact, we seen that there are maybe many steps that are blocked by insurance companies to agree before a patient would travel to another country to cover the cost of the care. So this is blocking, for example, for patient in Belgium that would want to come to France.
Yeah.
The S2 form needs an authorization from the insurance companies. And it has not been documented so much, but there are many patients that couldn't come to France or other countries requiring S2 because of that. So do you have do you know some initiative, or is it something that is nobody is talking about, and we have patients that fail to access to treatment because of that?
I'm sure there are initiatives, but I'm not aware. So if they are,
Okay.
they're not possible. They're not very visible because otherwise I would have heard of them. And I think that's maybe a good point because we have all those medical conferences on rare cancer or rare diseases. And as I said, I think the organization of expertise is one of the topics that need to be addressed at such conferences as well, because you have all the people together that make those decisions or can support those decisions. And I think the financial burden for patients is something that also should be taken into consideration if you're talking about this specific topic. So if it's there, it's not visible enough.
Yeah, clearly. So maybe another way to address this issue is, as you said, increase the knowledge of different physicians or caregivers about these very rare diseases, or help them with a tool to have the sufficient knowledge to know about the treatments, the clinical trials, and hopefully maybe that's a bit dreamer, but spread the treatments close enough to the patient. For example, clinical trials open in more places, or treatments accessible and reimbursed or covered in different places.
Well, I think that an individual physician never knows everything there needs to know about the rare diseases. So we always say that we need a multidisciplinary teams to work with patients with the rare diseases. And I think that's essential. And that's also why I cannot stress enough that the organization of care for rare diseases is so important, that you're not depending on one specific physician, but on a team. And I think ideally the clinical trials would come to the patient, and the patient should not travel to a clinical trial. And maybe in a not too far future, it would be possible to have designated trial centers in each country where the international trials are taking place. So all the how the organization of the trials should be copied for each country. So the patient shouldn't have to travel to the trial, but the trial will travel to the patient. That's difficult, but if that's your ultimate goal, you need those centers of expertise in every country. And of course, that needs a lot of discussion. But we need the numbers for the rare diseases. And as we all see the financial burden, but all the other problems that patients are facing, that really blocks the clinical trials from being the most successful as they can be. If you don't have the numbers, you don't have the outcome. Easy as that. So I think that should be our ultimate goal, and then we wouldn't have all the problems leaning on the patients.
Caroline, I think we've discussed many topics. Do you have some other things you want to address?
Well, I think that patient organizations in general can play a very important role, both in patient advocacy efforts towards governments, hospitals, any organization that is involved in the care for these rare diseases, but also for a patient. Patients with a rare disease often feel lost. They don't have a benchmark. Everybody knows somebody with breast cancer, but if you have a chordoma, nobody has heard of it, and you just don't know. And I think that patient organizations can play a very valuable role for these patients, for the individual patients. And I would want more patients to contact us so we can offer them the help that they really need, and make life easier. I think that's our main goal. It's difficult enough with the disease, so